What do you do when you have the sensation of a knot in your throat that just doesn't go away? And maybe you've even gone to your doctor and asked them about it, and they've said they can find no physical reason for it. And then they give you that look that says, I think you're a hypochondriac. Well, you're in luck, because today I'm going to talk about one of the 6 healing breaths. This breath is called Qi. Welcome back out to my channel. Today we're continuing on with my 6-part series on the 6 healing breaths. These breaths are from Daoism and are used in Chinese medicine, in QiGong, and are used to address physical medical conditions in the body. For each one of these breaths, there's 3 things that I want to cover. First is a Chinese name, which check, we've done that. Second is going to be the symptoms that each one of these breaths cover. Let's take a look at the symptoms that it addresses. I wanted to start with this breath because it resonates with me. That sensation of having a lump in your throat for no physical reason actually has a medical label. Globus Hystericus. And just the name alone doesn't sound good. It makes it sound like it's more about you instead of the symptoms. It actually makes you sound like you're a hypochondriac. And if we go into the causes of Globus Hystericus from a Western perspective, there's only a couple physical reasons, one being acid reflux. And if you check out my 30-day challenge series, that goes over one of the leading causes of acid reflux in the US. But there's really only a couple physical causes of Globus Hystericus, and if it isn't one of those, then you have hysterical neurosis. Ugh, hysterical neurosis? What is that? Okay, just saying something like that sounds like name calling, and it sounds like there is something inherently broken within you that cannot get fixed. Hysterical neurosis, characterized by irrational fear or obsession. For the patient, a prescription of the latest mood elevator doesn't eliminate the symptom, and it doesn't even make sense. You know, they're saying in their head, well, I went to bed one night and I was fine, and then I woke up the next day and I have this block in my throat that hasn't gone away. And suddenly I have an inherent mental illness that can't be fixed. So one night I'm fine, I wake up the next day and I'm not. Which is why patients get so irritated with their doctor. It's not that dramatic in Chinese medicine. In fact, check out my video, Chinese Medicine and Disease, to get a better understanding of how Chinese medicine sees disease. This Globus Hystericus is not a new disease. In fact, according to Chinese medicine, it's as old as civilization itself. The first formula, the first documented formula that deals with Globus Hystericus comes from the Han Dynasty, the second half of the Han Dynasty, so between 150 AD to 219 AD is when the first documented formula specifically for Globus Hystericus was identified. And I said Chinese medicine dealt with this a little bit differently. The first thing that they dealt with differently is they didn't call it Globus Hystericus. In fact, they didn't label it with something that said you're inherently broken. What they did is they called it plum pit sensation, which is pretty much what it feels like. It feels like a plum pit stuck in your throat. And when you look at the pathology of plum pit from a Chinese medical perspective, it comes from predominantly 2 channels, the liver and the lungs. In 5-element theory, each yin organ is associated with a different emotional expression. If we look at physical disease in the body, each one of those organs is associated with a completely different physical disease. Heart attacks, heart is very different from liver jaundice, is very different from the pancreas no longer able to create insulin. All of those diseases are very unique and specific to each of the organs. Likewise, your emotional response to each of these diseases is very, very different. In fact, talk to people who've had a heart attack and ask what they were feeling right before that heart attack, because most of them will say that they were feeling anxious and nervous. And that's an emotion that's associated specifically with the heart channel. Again, if you went back and looked at my video on Chinese medicine and how they see disease, you're going to see that disease starts way back before you have to be in the hospital for emergency surgery. Let's go back to the liver and the lungs. There's an emotional expression with each one of these. And when the liver's in balance, its expression is kindness. And as it gets out of balance, its expression becomes anger, resentment, frustration, hostility, biting, judgment. And it also is associated with stress. Some people feel really stressed out because they've spent their whole life having to stuff emotions because it was not allowed or not safe to express emotions. Other people get this feeling of being pent up, like they just feel like they need to explode. You know, other people feel it's a type of depression where it's almost like you've been beaten down so much that you're just perpetually depressed. In Chinese medicine, plum pit really gets a foothold in the body from excessive long-term chronic stress. Yet there is this underlying lung pathology of sadness, grief, the sensation of feeling alone in the world or that things are insurmountable. The other thing that happens with plum pit is that it might come and go. And if you try and keep track of it, really when your stress levels start increasing is usually when it comes back in and it comes back in stronger. And here's one way to learn more about yourself, because the response is usually immediate. You're going along and then all of a sudden something happens, you're interacting with someone, and all of a sudden you can start to feel your throat constricting, can start to feel it tightening. That's pretty indicative that whatever's going on in that conversation is causing you a lot of stress. In this interaction, whenever you feel that plum pit start to rise, it's that specific thing that's kicking you off. And it's that thing that's been going on for so long and so chronic that now you have this lump in your throat and your Western doctor is calling you hysterical and neurotic, which makes this whole throat thing worse. So when this happens, you might want to think about it, because it's these people that are triggering you off. And until you get stronger, you might want to limit your time with them. But if it's happening at work and that, you really can't limit your time around these people. And then you might want to look at some other tool sets to use to help improve this sensation. And that's where this breath sure comes in. Using Chinese medicine is a great option, and you can get more information on using Chinese medicine to deal with your emotions in my video, Using Chinese Medicine to Feel Normal Again, or you can pick up my book, Caregiver Survival Guide, How to Eliminate Stress in 30 Minutes with Chinese medicine and other tools. That gives you a great understanding of 5-element theory and nature, and how you choose nature in order to mellow out a mood. So we talked a little bit about the emotions that come with the sensation of plum pit. So to a certain extent, you know, these are related to the emotions, but not in the way that Western medicine sees it, not in the way that you're broken. In Chinese medicine, they see it as you've been under a ton of stress for a long time. You've been feeling alone in this world for a long time. And you've been fighting a fight for a long time, and you're just exhausted. And what Chinese medicine does is it uses tools to help rebuild you so you become stronger, so you can address these things. You know, getting back to normal is about all the tool sets that we can bring to help manage our emotions. And the breath is just one more tool that you can use. What I really like is you can use it anywhere. Okay, let's do this last part here where we get to practice the breath. How do you form this breath? Your mouth is wide open and you exhale through your mouth. And you exhale gently, so you don't force the breath out. Remember when you're trying to see if your breath stinks, you do yeah, so that's how you form it. It's really like you're trying to check if you have bad breath. So you breathe in and then you breathe out. You know, getting back to normal is about all the tool sets that we can bring to help manage our emotions. This is just one more tool set from Chinese medicine for you to help improve your life and make your life better. We've covered the 3 things that we were going to cover. Until next time, I'll catch you guys on the other side.